ดีค่ะ In this video presentation, we're going to summarize our editorial paper. My name is Orana from International Health Policy Program. I'm going to present on behalf of the team. This editorial reviews market promotion and industrial interference in NCD prevention and control. In the context of trade liberalization, which promotes the availability and consumption of goods and services through reductions of taxes and tariffs, the increased consumption of alcohol, unhealthy foods, and breast milk substitutes, or BMS, is boosted by aggressive market promotion. This is particularly so in countries with fast economic growth and increasing household disposable income. NCDs are the leading cause of death and prominent cause of disability worldwide, especially in low and middle income countries, where economic growth and modernization have opened wide the entry point for the spread of unhealthy lifestyles. And despite the global commitments and availability of scientific evidences and so many good practices, but it still seems that progress of NCD prevention and control are insufficient globally. In 2018, the WHO Director General reported back to the high level that most of the UN member states are off track towards NCD prevention and control achievement. To tackle the determinants of NCDs, the World Health Organization or WHO suggests some best-buy interventions. These are defined through an average cost-effectiveness ratio of international dollars less than 100 per disability-adjusted life years, awarded in low and lower middle-income countries. For example, tobacco warnings increase people's attention to and recall of health messages, which ultimately reduces smoking and motivates quitting. Graphic warnings pictures enhance the effectiveness of warning labels. Emerging countries are considered as best targets for market promotion of alcohol, tobacco, BMS, and SSB. For example, evidence shows that Asia is the fastest growing alcohol market, with more than 30% of global sales in 2014. With a growth of more than 176% between 2000 and 2019. Active market promotion in Asia results in significant increases in alcohol consumption among youth. The global market of BMS grew by 40.8% between 2008 and 2013, mostly in East Asian emerging markets such as China, Indonesia, Thailand, and Vietnam. It grows from 5.5 to 7.8 kilogram BMS per infant or child per year, and was predicted to increase to 10.8 kilogram BMS by 2018. These are common interference tactics conducted by the tobacco industry to interfere with policy process. First, they sue the government, and we witnessed this in Kenya and Uganda, where they've been sued by tobacco industry for their Tobacco Control Act and law. Second tactic is by providing a half-truth to the public. Through counteract, governments increase size of health warning label. And the last common tactic is they try to reduce the role of legally binding document by interpreting the Article 6 of the Guidelines on Price and Tax Measures to reduce the demand for tobacco adopted by Conference of Parties 6 to be a non-legally binding instrument. And for alcohol, these are their common tactics, and there are many evidences related to alcohol industries interfering the policy process. Approximately 2/3 of the funding for a recently commenced $100 million clinical trial to investigate possible cardiovascular benefits of alcohol has been reported. And have been provided by 5 global alcohol producers, which causing concerns on corporate influence on public health science and policy and funding effects on research funding. Alcohol industry actors are highly strategic, sophisticated, and well organized in influencing national policymakers. The alcohol industry actors seek to influence the policy in two principal ways by 1. Framing policy debates in a congruent and internationally consistent manner, and 2. Adopting short and long-term approaches to managing threats to commercial interests within the policy arena by building relationships with key actors using a variety of different organizational platforms. And for unhealthy food industry, they apply similar strategies to tobacco and alcohol industries. First and the most common tactics is by questioning the scientific evidences. In Thailand, the introduction of SSB tax in 2017 to address obesity resulted the high resistance from the Thai Beverage Industry Association. They question the validity behind scientific evidences that provide the foundation to the policy. Their argument is that there are no enough empirical evidences that can support the association between sugary drink and obesity in Thai context. A second tactic is by pressuring lawmakers to delay the implementation of SSB tax. And soda makers also have cultivated close relationships with doctors, scientists, and professional societies, especially by sponsoring scientific studies and academic forums. And here are the conclusion of this editorial paper, that these are the 4 common tactics used by industry to interfere with NCD prevention and control. 1 is influencing the legislative process. 2, using front groups to act on their behalf. 3, questioning the evidence of harm and the effectiveness of harm reduction interventions. And 4, appearing responsible in the eyes of the public, journalists, and policymakers. And trade agreements provide platform for industry to introduce legal challenges and undermine government measures to control tobacco and alcohol. And these tactics can be especially effective in the context of poor governance, high corruption, and conflict of interest among political and government actors, as well as regulatory captures. And for the recommendation, the WHO Framework of Engagement with Non-State Actors, or FENSA, can be applied to country contexts when engaging with private entities in the prevention and control of NCDs. And this is very important to strengthen the capacities of government lawyers to defend lawsuits by industries and take litigating against law violations. And this is the end of our presentation. So thank you very much for listening, and please feel free to contact our team for more information. Bye bye.